Hello everyone, welcome to the Ear Guide, a channel in which we will learn how to deal with different conditions that present in the ER. Today our topic is anaphylaxis. What is anaphylaxis? Anaphylaxis is basically a very severe allergic reaction. And this reaction is so severe that it can become life threatening very quickly. What happens is that our body reacts to some foreign substance, and that foreign substance can be anything. It can be any drug like NSAIDs, antibiotics, or even some vaccines. It can be any food product like peanuts or eggs or any other thing a person is allergic to. It can be due to insect bites, particularly from bees and wasps, and it can be due to certain seafoods. It can be due to any other thing the person might be allergic to. Basically, what happens is when that foreign substance enters the body, our immune system reacts to it, and that reaction, it can be IgE mediated or it can be complement mediated. However, in both cases, the end result is the same. What happens is mast cells and basophils, they degranulate, they release a whole cocktail of substances which includes histamines and related compounds like prostaglandins and thromboxanes and platelet activating factors, and all of these compounds, they act together and cause a whole bunch of symptoms which we term as anaphylactic shock or anaphylactic reaction. Now, what are the symptoms? What are the clinical features? What are the signs of this anaphylactic reaction? Basically, the signs happen all over the body. It is a multi-system presentation. Okay, what happens is different systems are affected, and these different systems, when a patient presents to you in the ER, you have to assess all these symptoms, all these signs in a systematic order. And for that you will perform the primary survey. And what is the primary survey? As you all should know, it is A, B, C, D, and E. All of this primary survey should be performed. A is airway, B is breathing, C is circulation, D is disability, and E is exposure. But the primary things which we are focusing on for anaphylaxis are the first three: A, B, and C: airway, breathing, and circulation. So, what happens to the airway? The airway, it can become blocked. The upper airway can become blocked. Why? Because when the body is having this reaction, there is a lot of edema, and this edema, it can present to you in the mouth, it can present in the pharynx, and it can present in the larynx as well. So the upper airway can be blocked due to this edema. So when a patient presents, it is important to assess the airway and whether a patient needs some airway support or not. And the second thing which we must see is the breathing. The breathing, it becomes labored, it becomes difficult. A patient may start to wheeze. Why? Because there is bronchospasm. Bronchospasm. What happens is the substances that are released from the mast cells and the basophils, they cause this bronchospasm. And bronchospasm, it makes breathing very difficult, and the patient can enter a high hypoxic state. The oxygen saturation of the patient can decrease very rapidly. And now what happens to the circulation? To the circulation, basically the substances that are released, they cause vasodilation. And this vasodilation, it is very dangerous. What happens is hypotension happens, the blood pressure, it drops, and the patient can go into shock. And when this happens, the condition is termed as anaphylactic shock. Other than these signs and symptoms, what happens? You may experience stomach pain or discomfort. The patient may experience nausea and vomiting. Patient may be feeling faint, or patient may be feeling weakness. There is a sense of impending doom, a sense of panic, and the patient may suddenly collapse. All of these things can happen, but the main things which we must focus on are the A, B, and C: the airway, the breathing, and the circulation. These are the things which will allow us to diagnose this condition very rapidly. What allows us to save lives in the ER is there are two things which allow us to save lives in the ER. The first one is the rapid diagnosis, and the second one is the rapid treatment. So we have learned how to diagnose an anaphylactic reaction. We have learned about the signs and the symptoms, but we must also know how to treat it rapidly. So there I have a very comprehensive algorithm over here. So first of all, are you suspecting an anaphylactic reaction? If yes, how will you diagnose it? You will diagnose just as I told you from the primary survey: airway, breathing, circulation, disability, and exposure. Primarily the first three: the airway, breathing, and the circulation. You have to look for the acute onset of the illness, and you have to look for life threatening airway, breathing, and circulation problems, as we have just discussed. And there can be skin changes like the swelling and the redness and all of that stuff. Now, if you have diagnosed it, what to do next? First of all, you will call for help. This is a life threatening condition. You do not want to be treating the patient alone, because many things can go wrong, many complications can occur. A helping hand, and other doctor, nursing staff, all of them helping you can make the difference between the patient living and dying. Okay, first of all, the first step is to call for help. Then you lie the patient flat and raise the patient's legs. Why do you do this? Because when the patient will be lying flat with his legs raised, all the blood will go towards the heart, and when it will go towards the heart, that will help to offset some of the hypotension, some of the shock symptoms that are happening. Okay, so that is an important step of this treatment. Then the other thing that is most important is adrenaline. Adrenaline must be given intramuscularly. You should give adrenaline intramuscularly, and the dose varies between adult and children, but for mostly for adults and children greater than 12 years old, you will give 0.5 ml of adrenaline intramuscularly. This is the very crucial step of the treatment of an anaphylactic reaction. It is the most necessary step, and it is the step that you must never miss. All of the other things are adjuncts to this. Okay, so you have to give adrenaline as soon as possible. It is crucial because the adrenaline, it will cause vasoconstriction, it will offset the shock symptoms, but since it acts on the beta receptors, it will also cause bronchodilation. It will also help the patient in breathing properly. These were the two main issues. The patient was not breathing properly, and the patient was going into shock. So adrenaline is the most potent drug in this treatment algorithm, which will offset this. Now there are some other things that you will have to do depending upon the condition of the patient. First of all, you have to establish the airway. If you have during your primary survey, if you have assessed that there's too much neck swelling, there's too much facial swelling, the patient might need an airway, then you will give the patient an airway. Okay? The airway can be oropharyngeal airway, or it can be it can be an endotracheal tube, it can be a tracheostomy. That depends upon the condition that you are faced with. And you give the patient high flow oxygen to help the patient breathe, because there is bronchospasm and the patient is unable to breathe. You give them high flow oxygen, the patient is having low oxygen saturation, you need to offset that. And with this high flow oxygen, you have an other option. You can give beta 2 agonist as inhaler. You can give which drug will be beta 2 agonist? The drug of choice will be salbutamol, which is a short acting beta agonist. It will help in the bronchodilation. You give it as an inhalation, you give it as a nebulization along with the high flow oxygen. And to offset the shock symptoms, you can give IV fluids. You can give normal saline to the patient. You can give a fluid bolus to offset the shock symptoms. And there's some other drugs that you can give. Chlorpheniramine, which is antihistamine, it will prevent the actions of the histamine which is being released from the mast cells and the basophils. It will help in reducing this allergic reaction. And you can give hydrocortisone, which also acts against all of that cocktail of chemicals which was released, the prostaglandins and all of that. It acts against that, and it helps in reducing the symptoms of the anaphylactic reaction. And along with all this, you will keep a constant monitoring of the patient. You will do pulse oximetry, you will monitor the oxygen saturation, you will monitor the blood pressure, because these two things will mainly show whether your treatment is working or not. And along with this, you will also perform ECG, as these substances which are released, they may cause arrhythmias. These substances, they can cause arrhythmias. That's why you do the ECG. One ECG is must for a patient which is having anaphylactic reaction. And if you find arrhythmias, you treat them, you do serial ECGs as well. Okay, so this is the whole treatment algorithm for anaphylactic reaction. Now you can deal with the anaphylactic reaction when it presents to you in the ER, and you can save a life. Now, thank you for listening. Subscribe to this channel and see you next time.